infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, when there's global infectious disease outbreaks, one tool that governments use is traveler screening, like what we're seeing right now with the current COVID-19 outbreak. So how effective is it? How effective is traveler screening? Well, there's a new study that was recently published in eLife entitled Estimated Effectiveness of Symptom and Risk Screening to Prevent the Spread of COVID-19 that takes a very good look at this. So joining me today is Katelyn Gostic, PhD. Dr. Gostic is with the Department of Ecology and Evolution with the University of Chicago, and she is the lead author of the study. Dr. Gostic, welcome to the show, ma'am.
Thanks for having me.
Sure. Now, traveler screening is a common tool used to limit further spread of infectious diseases in a global response, like what we saw with Ebola and now with COVID-19. Dr. Gostic, what are the typical travel screening methods that are employed?
Right. So WHO guidelines recommends that travel screening occurs using a symptom screen where people are basically checked for fever, or if they have any obvious respiratory symptoms like cough or difficulty breathing, they might also be detained. And then screening also usually includes sort of a self-reporting questionnaire that asks people about their travel history of close contact with known cases, and other potential risk factors.
So you previously looked at the effectiveness of traveler screening to prevent the spread of emergent pathogens back in 2015. And now you estimate the impact of different screening programs given current knowledge of what we know about COVID-19. Can you talk about your study and the methods employed?
Right. So we have a mathematical model which basically assesses the probability that an infected traveler is going to be detected in either mode of screening. So in either the symptom screen or by self-reporting on a risk questionnaire. And essentially what we find is that for COVID-19, as for many pathogens, overall screening is not going to be very effective. Screening is likely to miss about 50% of infected travelers. But crucially for COVID-19, we find that those screening misses don't really represent sort of failures of human implementation or bad policy. It's just that the majority of travelers passing through screening are probably going to be fundamentally undetectable. And that's either because they haven't yet developed symptoms, because they have a mild case and don't show fever or cough, and because they might not realize that they were exposed in the first place.
So is that similar to what you've seen in other global outbreaks?
I think the overall effectiveness is similar. I think the contributing factors to screening misses, vary from pathogen to pathogen. So the big challenges we're seeing with COVID-19 is that the incubation period is moderately long. We've seen pathogens that have a little bit longer incubation, but, the shortest possible incubation period is not what we're seeing here. And additionally, it looks like a lot of people are not showing any detectable symptoms at the time they're diagnosed when prospective screening is done. So that's in populations like people who are currently in quarantine or people who are on the Diamond Princess cruise ship off the coast of Japan. A lot of people being diagnosed in those scenarios don't show any detectable symptoms at the time of diagnosis. And I'd say an additional challenge here is that because the majority of transmission appears to be occurring via the airborne route, a lot of people seem to not realize that they were exposed in the first place, which makes those risk factor questionnaires not as effective as we'd like them to be.
So lastly, what can we take from these findings? I mean, what can we do to improve the mitigation of disease spread?
So, as I said before, ineffectiveness of screening is not unique to COVID-19. We know that screening is inherently leaky, and because all infectious diseases have an incubation period, screening is going to miss a lot of people who are traveling at a time that they haven't yet developed symptoms and don't know they're sick. So this is why screening is not a definitive barrier to infectious disease spread. And public health departments know this. This is why, CDC and International Centers for Disease Control have on-the-ground contact tracing. They're spending a lot of time and money trying to track down people that could have become exposed once a case is detected and trying to stamp out local chains of transmission before they start. So to put that another way, the ultimate goal of containment is not necessarily to prevent every case from hitting the ground, but to make sure that once cases do hit the ground and are missed by screening, that they don't start local chains of transmission.
Yeah, and with a approximately 50% effectiveness, is it reasonable to question, like, maybe we could be putting our resources elsewhere? Or what's your thoughts?
Yes, I definitely agree with the CDC's current stance in the United States, which is that sustained spread and case importation is not really a question of if, but when. And at a certain point, we're going to reach a tipping point. We might even be there already with new evidence for community transmission in California, where screening is not going to be a great use of resources and might sort of marginally delay the importation of new cases, but really resources might be better used to slow the spread and address this as a sustained epidemic and not focus so much on containment.
Well, very good. Interesting study. And I'll link to the study in the show notes when I publish the podcast for those of you who want to take a look at it. And I want to thank you, Dr. Katelyn Gostic, for your time and your expertise.
Great. Thank you so much.
You're welcome.